Good afternoon to you all. I'm Dr. JP Singh. Welcome to our channel. Today we are discussing abortion and MTP part 2. In our previous lectures, we have discussed MTP and there are few new updates on this topic. One from Supreme Court of India and one from Bombay High Court that we'll be discussing. And there are few other topics which will add to our previous lectures. Starting now. This is the news which came from High Court of Bombay, which says termination of 34 weeks of pregnancy by feticide. The term here they have used feticide in the womb gets High Court nod. So Justice Dangre and Justice Deshpande, they allowed petition number 1 to terminate the pregnancy by performing feticide in the uterus prior to delivery. The patient was 37-year female and her husband. They moved to the High Court after the medical board in the district civil hospital advised against the MTP. The board advised against the MTP, so they moved to the High Court asking for termination of pregnancy. And they had opined the fetus is detected with non-lethal short limb skeletal dysplasia. That means non-lethal limb dysplasia. As per them, this does not fit any of the definitions or any of the clauses for the termination of pregnancy as allowed by the court in their previous directives as per the MTP Act amended 2021. So there is no life-threatening anomaly identified and the condition is compatible with postnatal survival. The board said that it is compatible with postnatal survival. So the couple's advocate, so-called Minas Kakakia, he relied on a High Court Feb 2025 decision. He quoted decision given by the High Court in Feb 2025, where the board had recommended MTP of a fetus with skeletal dysplasia. Right? Previously, the High Court, same High Court, they have allowed a termination. They allowed the High Court had allowed termination of pregnancy with dysplasia. The fetus had dysplasia. Quoting same judgment, they asked for termination of pregnancy in their case. So the High Court recommended MTP and concluded the fetus is affected by serious congenital abnormalities or mental abnormalities, and continuation of pregnancy is likely to result in the birth of child with significant morbidity. Relying on that same judgment, they asked for termination and the court allowed the termination of 34 weeks of pregnancy. Second, the Supreme Court of India, it allowed termination of a 30-week fetus in a minor. So here it is, they are allowing feticide and they are again asking for termination of pregnancy in a female who is a minor and is 30 weeks pregnant. So the court was in dilemma. The court was in dilemma to decide between protect the interest of a 30-week pregnant minor or save the unborn child who has a 30-week fetus having a beating heart. The court tilted in the favor of the girl and allowed termination of pregnancy, saying she can't be compelled by the court or the society to give birth to a child. So moving on in the light of these lines, we will be moving ahead and discussing few new additions to our previous lecture. So for the court, MTP is the termination of pregnancy from the beginning till the end of the pregnancy. That means 36 to 40 weeks, or as per the general public, it is around 9 months. But for us means medical professions, it is professionals, it is abortion up to 3 months, miscarriage, the terminology changes from abortion up to 3 months. It is now miscarriage from 5th, 6th into 7 months. And when it is more than 7 months, it is premature delivery, right? So the term is changing from abortion to miscarriage, from miscarriage to preterm delivery, third, seventh, or more than 7 months, right? Now we'll touch up on the topic abortion. We'll classify abortion as natural or spontaneous, or induced or artificial. In our lecture, we will be discussing thoroughly only on natural or spontaneous abortion. And natural abortion, it can be, or spontaneous abortion can be threatened, inevitable, complete, incomplete, missed, or septic. Threatened means it is about to be, this pregnancy can be saved. Threatened abortion means the patient has detected some abnormality in the continuation of pregnancy, some bleeding and something, and it can be prevented. But when it enters into phase of inevitable, it is likely to be a complete abortion. It is likely to go into a complete abortion. And incomplete abortion and complete abortion means there is the product of conception has come out completely, but in incomplete it has not come out and something is left behind in the uterus. The term missed abortion is used when the abortion is not detected by the patient. Since the symptoms of or signs of abortion, they are absent, like pain, it is generally absent in missed abortion. And septic abortion, it is due to infection in the uterus or by some illegal agency to cause the abortion. Second, the induced or artificial abortion can be legal or illegal. So what is legal and illegal? We'll see in further slides. We have already discussed what is abortion and how it is different from miscarriage. So the term for us is abortion, one, and second miscarriage. But for law, the both terms, both the thing means abortion is same in different duration of pregnancy. Different duration of pregnancy. So for us, the abortion is premature expulsion or extraction. Expulsion is without any intervention of external agency. Extraction is after we apply some medicine or some instrument. Expulsion or extraction of the fetus from mother's womb at any time of pregnancy before full term is completed. So we'll be discussing mainly natural or artificial abortion, but we'll touch upon the criminal also, just touch upon. For natural abortion, they most commonly occur in first trimester, first or second trimester. That means up to 12 weeks, right? Mostly in first trimester up to 12 weeks, and they constitute about 10 to 15% of total abortions. Out of total, 10 to 15 are natural abortion, 10 to 15% are natural abortions, and 50% of these abortions are due to genetic causes. Due to genetic causes, due to chromosomal, and out of these, the trisomy is the main factor. Trisomy of autosomal chromosome, and in this it is autosomal 16, chromosome 16. Trisomy of chromosome 16 is the most common reason for natural abortion, followed by the anatomic or endocrine or infectious. They are contributing 15, almost 50% each, right? Anatomic means there is deformity in the anatomy of the female or the structure, the reproductive structure of the female. Endocrine means the hormonal effects causing the discrepancy in the hormonal factors causing abortion, and infectious. Out of these, maximum are caused by viral infection, viral infections, right? Artificial abortion, it is a legal abortion which is justifiable only when done in good faith to save the life of the female. artificial or legal abortion or therapeutic abortion, it is justifiable only when it is done to save the life of the female, where it is materially endangered. If we are not continuing with the abortion, or if we are not going for the abortion, the life of the patient is in danger. And this legal abortion, it was adopted by World Medical Association by Declaration of Oslo in 1970. So since 1970, abortion is legalized in different parts of the world. Criminal abortion is induced, it is induced destruction and expulsion of the fetus from the womb of mother unlawfully, where there is no therapeutic indication. There is no therapeutic indication. That means it is criminal abortion, and it is usually done before third month of gestation. Since we are talking about criminal abortion, it can be done any time during the pregnancy, but generally it is done before third month of the pregnancy. Legal aspect, majorly we will be touching upon legal aspects, and on the abortion, it starts from section 312 and goes up to section 316 IPC, or 88 to 92 of BNS. Starting from 312, it is any individual who is voluntarily causing criminal abortion, he may be imprisoned up to 3 years or fine, or fine. And if the female is quick with the child, that means if the female is quick with the child, that means if the female has the period of gestation has entered into second trimester, the fine and the imprisonment, they are together, and the imprisonment is up to 7 years. And in this case, this includes pregnant woman of herself, right? Section 312 or 88 of BNS. Then section 313 of IPC or 89 of BNS. Here the miscarriage is caused without the consent, right? Without the consent is the main factor here. Without the consent of the female. So the imprisonment may be up to 10 years, or it may go up to life, depending on the situation of the patient. Number 3, section 314 IPC or 90 of BNS. If the pregnant female dies during the act which is intended to cause the miscarriage, if there is death of the patient during the act of abortion, the imprisonment is up to 10 years and fine up to rupees 2 lakh. It is very well defined, but the fine was not defined in 312, but it is defined in 314. And the last is section 316 or 92 BNS, where the act caused death of a quick unborn child. It amounts to culpable homicide, and the imprisonment is again up to 10 years. So majorly in all the acts of illegal or criminal abortion, it is up to 10 years, except for section 313, where it is up to life, where it is without the consent of the patient. The Mtp Act 2021 with the amendments, it was implemented in 1971. We have discussed in our previous lecture, and came into force in 1972, amended in 2002, 14 and 21. In our previous lectures, we have discussed the various therapeutic, eugenic, humanitarian, and the socio-economic reasons for the abortion. If you want to know the detail, please go to our previous lectures. And the changes which are in the Act as per the 2021 Amendment Act, they are mainly for the duration of the pregnancy and the confidentiality. For the duration, initially which was till 12 weeks or 20 weeks, now from 20 weeks they have extended it to 24 weeks. Abortion can be done from 20 to 24 weeks. In the previous cases, previous Mtp Act, it was Upper limit was up to 20 weeks. Now it is up to 24 weeks. Secondly, opinion of one doctor was required up to 20. In the previous one, it was required up to 12 weeks, one doctor, but now it has gone up to 20 weeks. So 12 is replaced by 20. And here the two doctors, they were required from 12 to 20 weeks in the previous one, previous MTP Act. Now it has gone from 20 to 24. Since 20 is replaced by 12, right? 12 is replaced by 20. So the upper limit, it has gone up to 24. And this thing is very important. This is very new to the MTP Act 2021. It is access to safe abortion for unmarried females, right? And how it is important, we'll discuss in our next slides, next few slides. And protecting the privacy and confidentiality of the patient. It is very important. Now, the document where we are enrolling our patient, it is a confidential document, and there is no name but a number, to each patient. No name or any detail of the patient, they are not entered, but a number is given to each patient, and they come to the clinic or the hospital with same number each time. Again, just to repeat, up to 20 weeks, one doctor, 20 to 24 weeks, the upper limit, up to 24 weeks, two doctors for special categories, right? The categories, if you want to know what are the special categories, just go to our previous lecture where we had discussed these special categories in detail. More than 24 weeks, the medical board, it is medical board required. In the first slide, where the High Court and Supreme Court, in both cases, there was a medical board with fetal abnormalities. And again, important thing, any time during pregnancy where the life of the patient is in danger, one doctor can carry out termination of pregnancy if it is necessary to save the pregnant woman's life. It is most important to save the life of the patient. If the doctor is competent enough, he can carry out termination of the pregnancy. And the last slide for us, this is very important. Amendment done in 2002 in the MTP Act, it replaced the term lunatic. The term lunatic was given in the laws by English people. It was replaced with mentally ill person. To give dignity to the patient, it was replaced by mentally ill person. And the legal standing of the MTP Act was improvised, where they removed the consent or the approval of the husband and given the consent only by the patient or the female is enough to cause MTP for the pregnancy. The consent of husband is not required, whereas it is required when we are into the process of sterilization. But abortion or MTP, we do not need consent of the husband. And there is no limit to the abnormalities. That means if the fetus is abnormal, the upper gestation limit does not apply. If the product of conception of the baby is abnormal, the upper limit of 24 weeks does not apply. And we have discussed the unmarried female confidentiality clause. The failure of contraceptive clause is extended in 2021 to unmarried females, and not just the married ones, allowing them to legally abort. Because before that, there were a lot of cases of illegal or criminal abortion, which were leading to the death of many females in remote or rural areas. So to control over that, they have included the unmarried female, for them the failure of contraceptive clause. And the MTP Act 2014, it was amended in 2014, where they allowed the homeopathy and Ayurvedic doctors to conduct medical termination of pregnancy. Right? The doctors, they were increased the number of patients by increasing the unmarried females and the confidentiality. These clauses, they have included many females which were not ready to come to the clinic because of breach of confidentiality or the husband clause. They all have been removed in the latest amendment, making it more patient friendly. So this was all from my side. And if you have any doubt, please mention in the comment box. Please do like, share, and subscribe to the channel. Thank you.